take a minute and have us all introduce ourselves, even though everybody is probably well known amongst this group. I'm going to leave the poll up while we do this, but I will end it shortly thereafter. My name is Dr. Linda Clark. I'm the Chief Medical Officer at Common Ground Health. My specialty is in preventive medicine, public health, and I've been practicing in occupational medicine for several years. Dr. Bennett?
Good evening, everyone. I'm Dr. Nana Bennett. My day job is with the University of Rochester Medical Center. I'm the director of the Center for Community Health and Prevention and also co-director of the CTSI. But my current job, and the reason I'm here this evening, is that I'm the lead for the Finger Lakes COVID-19 vaccine hub. And I'll tell you more about that as we go on. Thank you.
Thank you. Dr. Mendoza?
Good evening, everybody. Thank you for joining us today. I'm Dr. Michael Mendoza. I'm the Commissioner of Public Health for Monroe County Health Department. And I think more important this evening, I'm also a primary care family physician. I still maintain a continuity primary care practice at Highland Family Medicine, where I see patients a couple days a week. And I also serve on the inpatient service at Highland Hospital, where I'll be this weekend. And we'll talk more about my perspectives from the standpoint of primary care in a little bit. Thanks.
Excellent. Dr. Connors?
Hi, it's me.
Okay. Is Dr. Charlene Connors? No? Dr. Diego Conhelago?
Hi, my name is Diego Conhelago. I'm in a private practice in Rochester, New York, and I have been vaccinating people since the end of March, and so our experience is here to share with everyone.
Linda, can you hear me?
I can.
Okay, sorry. I'm Charlene Connors. I'm a privately practicing physician, equally vaccinating. Diego and I rolled this out together, and happy to be with you tonight.
Thank you so much. And I think we're going to ask Kathy Hiltunen, I'm probably saying your last name wrong, Kathy, I'm sorry, to introduce herself too, because she's going to join us in our Q&A panel.
Hi, I'm Kathy Hiltunen from Monroe County Department of Public Health. I have a number of vaccination pods that I run, and I'm just here to help to see how we can help primary care in general with the vaccination effort. Glad to be here. Thanks for inviting me.
Thank you so much. All right, well, our agenda tonight, we're going to talk a little bit about the survey that some of you filled out. We'll talk a little bit about the vaccine hub and data on vaccination. We'll talk about the need for vaccinators. We have you doing some work with us with breakout sessions right after Dr. Mendoza talks about equity strategies and how to become a vaccinator. Then we'll hear from people who are already doing it, Dr. Conhelago and Dr. Connors, and then take questions and answers from you. So why don't we go ahead and get started, and next slide. So there's great news on the horizon. 56% of people who are 16 years and older have gotten at least one dose of vaccine in our region. Next slide. And I love this slide. It's my favorite thing. We've been talking about that English muffin approach for a long time. So even when we were standing up these huge points of distribution for vaccination, we knew that eventually we would get to that nook and cranny work where we have to really dig in and start getting to our patients on a more personal level. Next slide, please. So, one of the things that I really thought Dr. Bennett was going to talk about, but I'm going to talk about, is our communications campaign. One thing that, Nana will probably talk about is just the collaboration that is occurring for all of this work to occur between the hub, the health departments, Common Ground Health. And one of the things they're coordinating is a communications campaign. This is Norma Holland, who we all know, and she's featured, as well as Scott Hesco, I do believe, on some of the communications that are going out to our patients and people in the community about vaccination, getting the facts that it's safe, it's effective, etc. Next slide. So when Common Ground Health did a series of what we call empathy interviews, when we talked to people in certain groups to figure out questions like, if you got a vaccine, who would you want to get it from? Who do you trust to give you good information about vaccination and whatnot? And in these interviews, it was very clear what we already know, that people, they want to talk to their doctor. They want to get the recommendations from their primary care providers to understand if vaccination is for them, to be able to answer questions. Next slide, please. So this is a little breakdown in terms of the empathy interview. Primary care providers convey trust. So in terms of vaccine communication, they're knowledgeable, they're felt to be knowledgeable about vaccines. Plus they have the added advantage of knowing their patients' health histories. So people feel way more comfortable with trusting what they say about vaccine side effects, about any particular interaction with the medicines they're on, with the conditions that they have. And primary care providers have a history of guiding patients through difficult times and difficult health dilemmas. So in terms of setting and locations, they feel like the doctor's office, the primary care doctor, the primary care provider's office is familiar. They know what to expect there. It's convenient. They like privacy. They want, some people want a discreet option. They may not want to, lift their shirt in public if they wore the wrong thing. And they felt that they really needed a clean space to administer the vaccine. So it was one thing going out and doing COVID testing in various settings. It's another thing getting a vaccination. So we can see that the primary care provider's office, and I'm trying to advance the slide, but I can't, Amy, advance, is really very important in terms of the trusted location and the trusted personnel. So these are just some quotes from the interview. So there's a Black man between the ages 40 and 64 who said, I would have to be in my doctor's office if I got it. Nobody, I don't know, my doctor for sure. A Latina female aged between 40 and 64 said, I would love to have the vaccine done at my doctor's office. I know everyone, they know the proper way to take care of me. Another Black man, this one young, aged 18 to 39, if I did get it, I would want it to be in a smaller setting that I'm familiar with, like my doctor's office, that I already use, that knows my medications and is familiar with me. I don't like all the community sites, too impersonal, too many strangers giving the vaccine. So this is really important information for us. Amy, would you advance as we plan the next phase in our strategy? So we asked you some questions about what it would take to vaccinate. Next slide. And this is a survey that people filled out prior to us planning this forum. And so a good 70% of people have not of offices have not given the COVID vaccination. So about 30%, a little less than 30% have, and a little over 70% have not. Next slide. So a good number of people, though, are not against it. 80% are interested, might be interested, or are already giving vaccines. So that was very good news. Next slide. Okay, so then we asked about barriers. What is keeping you? What is making it difficult? So obtaining that PIN, we got to get that PIN, and Dr. Mendoza is going to make sure we know how to get that PIN, that identification number that is all important and needed for ordering vaccine. the refrigerator. I had this experience myself in my own office. I've been through 2 refrigerators. Neither was acceptable by CDC standards. So that has apparently been a barrier for some other people too. But there were some staffing limitations that you can see, that having the staff to administer, having the staff to help complete forms and do the data entry in NICES was also a concern. Next slide, please. So when we asked about what tools do you need to help educate your patients, there's a good number said 20% said none. I'm good, but a fair number of people said they needed access to literature. And once again, here's that staff time again. I need somebody who's there and has the time to talk to the patients or make the phone calls or answer the questions. Then we got into a fair number of people saying they would like things like social media messaging, access to information on the web that they can give their patients, information in various languages. All of these came up as possible tools that were needed to help educate patients. Next slide. And now we get to hear from Dr. Bennett. Thank you. I'm not even
After a year, I keep doing that. It's amazing. Thank you so much, Linda. I wanted to tell you that really I'm here to listen to you. I'm not here to talk. We really need your help, and I'm going to tell you why we need your help. But we also think we may have some tools to help you. And so what we want to hear from you tonight is, what can the hub do to help you administer or at least discuss vaccination in your practice? And I thought I'd start with our website, which is a place where you can find a lot of information. It's a great place to send your patients to as well, because we have lots and lots of information on the website about the vaccines. We also have communications tools that you can use in your office. If I could have the next slide. Next slide, thanks. So we have a toolkit that you can use, but also other people can use to talk to people about the vaccine. And it has a number of different assets in it. You can use it on social media. You can use it to print out materials and hand them to patients. We do plan to have a physician-specific toolkit going forward. And Elisa Orlando is here with me tonight. She's the communications director of the hub, and we'll be listening very carefully to what you all say about what you could use. If I could have the next slide. This is just an example of one of the infographics that we have available on the hub website. And we hope that this will be helpful to people in their practices, but we've also been using them in the community. Next slide, please. So I forgot to say what the hub is at the beginning. And I think it's important to recognize that there are 10 hubs across New York State, and we are one of them for the Finger Lakes region. And the purpose of the hubs is to coordinate among all the vaccinators in a region. So what that means is that we actually meet. At first we met every single morning. Now we do it about twice a week. But we meet and talk about challenges that all the vaccinators are facing. And obviously you as private providers are welcome to join that call, but we're also here just to support you. And the other forms of support are communications supports and also data support. So on the website, we do have our regional data. If I could have the next slide. So as Linda mentioned, this is how we're doing. We have given about 57% of our population in the Finger Lakes region a first dose. About 43% of the population are fully vaccinated. That's really good news, except that it's screeching to a halt, which is really why we're here tonight. We're finding that we have lots and lots of empty appointments, and we really are not getting to lots of our population. And you can look at the data on the website. All of the data on the website are interactive, so you can play around, you can look at a particular county, you can look at lots of different aspects of the data. If you could go to the next slide. So this is an example of another part of the data that we have. We're looking at it by race and ethnicity. This is a problematic comparison, I want to warn you, because there are many unknowns among those who are vaccinated. You can see that about 12% of those who are vaccinated, we do not know their race. So that could really impact what we think we're seeing, which is lower levels of uptake among people of color. However, it's possible that the data are just bad because we don't know about a lot of people. However, the data are there for you to look at, and you can see how it changes over time as well. And if I could have the next slide. This is also a deeper dive into our data. And again, this is a completely interactive map. So you can go to a particular zip code and learn a lot about that zip code. But you can see when you look at this, and for me, this is the strongest take-home message of all, you can see that this exactly matches our socioeconomic status, essentially. In the city, we have lower rates of vaccination, and in the rural areas, we have lower rates of vaccination. And we have that big, beautiful ring of suburban with relatively high vaccination rates. So we have a lot of challenges ahead of us. If I could have the next slide. So I wanted to just say a word about vaccination supply, because one of the things that I think many of the providers in the community were unhappy about at the beginning was that there was no vaccine distributed to physicians' offices at the very beginning of the vaccine distribution. And this slide illustrates why. And essentially the reason was because we started with hospitals and healthcare workers and tried to vaccinate those first. And then we moved into the broader population. But when we did so, we were under tremendous pressure from New York State to use up all the vaccine we got on a weekly basis. And the reason for that was because New York State couldn't get vaccine from the federal government unless they used up all the vaccine on a weekly basis. So the focus initially was really on mass vaccination sites. And that worked well because for people who had a high level of demand for vaccine, they would go to large vaccination sites. But now we're in a different place. We had about 6 good weeks or so of getting a lot of vaccine and having a lot of demand. And now we have much less demand. And you can see that our vaccine supplies are plummeting because if we don't order, they don't send. And we don't order if we don't have arms to put it into. So we need your help. And this slide, I think, illustrates that about as well as anything could. And if I could have the next slide. This is just a little more data, but something really important, which is that we have done an incredibly great job with second doses. So at first we all thought, oh my goodness, 2 doses, there's no way we can do this. Turns out we've done it extremely well in our region. Only 3% of people have not gotten their second dose within 6 weeks of getting their first dose. And really no big differences across different groups. Only age seems to be related to a lower rate of vaccine getting the second dose. And that may be related to death, disease, a number of different factors, moving out of the area, so forth. And then the last slide. So this is my plea. When we first modeled how long it would take us to get to 80% of the eligible population, we thought it would be about the middle of June. With the reduction in demand that we're seeing, we're now expecting the last week of October. That is really disturbing, and we may not even get there. We may never get to 80%. So we need everybody's help. We need to be able to give vaccine in every single outlet in our community. We'll go to the people with small clinics. We'll do whatever we can to get to people's neighborhoods and to be in places they feel comfortable. But the places they feel most comfortable, as Linda so carefully explained to you, is their doctor's offices. And I know you know that. And we know it too. And we're here to do anything we can to make it possible for you to administer a vaccine. And if that's really not possible, to at least talk to your patients about vaccine. We've known for years and years and years, and all the studies that have ever been done, that the biggest factor that contributes to a person being vaccinated is their doctor's recommendation. So I hope that we can convince you tonight to join us. I know many of you already have. And we also want to be sure that we hear you about what tools we can give you to make it easier. Thank you.
Thank you, Dr. Bennett. And I will take over talking a little bit about where we are, talk a little bit about the importance of where we need to go, and then I'll share a little bit with you about the steps that you ought to consider if you would like to be a vaccinator yourself. And as Dr. Bennett said, our expectation isn't that all of you will be a vaccinator, but we really want you all to consider it, because the reality here is that we are at a point where we need to drastically pivot our effort around the vaccination program. So next slide. So our early efforts, oh, that wasn't what I expected. Are we at the, two more? Okay, well, I can talk about those points. The point here is that we are at a point in the pandemic where the variants versus the vaccine are in a race. And if we can out-vaccinate the variants, then we can see a sooner end to this pandemic. Unfortunately, as Dr. Bennett had mentioned, we are in some respects losing that battle, because we are not keeping up with the pace of vaccination that we had hoped that we would see. The rate that we had seen in the early weeks, we had sort of had this feeling that would, at least continue longer than we are seeing it now. It's now mid-May. We thought that that demand would last at least into June or July, but unfortunately that's not what we're seeing. And we also know that the B.1.1.7 variant, the variant that was initially identified in the UK, is the dominant variant here in the United States and here in the region in upstate New York. So we really need to out-vaccinate the variants. And the problem is that the demand has really waned off. And as you saw from Dr. Bennett, our supply has waned off because we're not able or not needing to request more vaccine. And so we really need to modify our strategy. Now, I kind of liken this to getting a new iPhone or getting a new piece of technology, where the early adopters, generally won't have any questions about it. They may be more tolerant of side effects, glitches, bugs in the new iPhone, if you will. And so all of those people, we essentially didn't need to convince. They were already convinced before the technology was rolled out that they wanted to get the COVID vaccine in one form or another. And so we intentionally wanted to ramp up the volume as quickly as we could, because we wanted to race toward herd immunity, because the more rapidly we could get there, the sooner we could get to that point where we might be able to out-vaccinate the variants. And so we've already done that. We've gotten to the point where when you open the doors, everybody comes in, they get their vaccine, they don't ask questions, and then they move on. Those days are unfortunately long behind us. And we're at the point right now where we need to shift our strategy, and where we know that we can't continue to keep using these mass vaccination sites. And so I want to take off my county health commissioner hat and put on my PCP hat, because I think the experiences that I've gleaned as a PCP are probably now more important than any other time in this vaccination program. Next slide. And we need to get out into the community. And to give you a sense of how this really hit home for me, I was in clinic a couple of weeks ago, and I still have a small practice a couple days a week. And a number of patients happened to come in that morning, and they said to me, "Doc, I want you to tell me to get the vaccine." And I said, "Haven't you heard me say that to you before?" And they said, "Well, yeah, I hear you saying it on TV, but I really want you to tell me as a doctor, not as somebody on TV." And that struck me, because these are patients that I've known for 10 years who I would have thought would have believed me, because I'm their doctor and they see me on TV and I'm not really saying anything different in person. In fact, if anything, I'm saying more on TV than I am in the office. And I see them in the office and I say, "Just get your shot." And they say, "Okay." They just want to hear it from me as their doctor, not me as the county health commissioner. And I think that speaks to the value that you all play as primary care doctors in our community. I don't need to tell you how trusted you are. And as Dr. Bennett mentioned, with almost any behavior change, whether it's smoking cessation or healthy lifestyle changes or changes in our diet, hearing a message from our primary care doctor is, by far among the most impactful ways that we can institute change in our patients. And so that's where we're at right now. And we've done pods in the community. We've gone to Frontier Field. Our patients have echoed the sentiment that they want familiarity. A couple of weeks ago, I was at Frontier Field, not even a mile and a half from the convention center downtown. And I was talking to patients as they came in, And I said, you know, we're not that far from the convention center. You know, what made you want to come out today? You didn't have an appointment, and that's great. We were happy to see you. But what made you want to come out to the Frontier Field to get your vaccine when we've been doing this for weeks, you know, less than 2 miles away? And they, you know, told me variations on the same story, which are that Frontier Field is where they go with their family. It's where they get hot dogs and beer. It's where they watch baseball games. It's a place that's familiar to them. When I was out at the Hilton Fire Department, you know, on the west side, I would ask the same questions, and I would say, you know, this has been available in our community. You know, you have transportation, you have a car, you drove here today. Why didn't you go out to the Dome Arena, or why didn't you go to the Hawkeye Center? And they said, well, I trust the Hilton Fire Department. I don't know the people at the Dome Arena. It's very impersonal. I don't know the people at Hawkeye. It's, you know, the fire department here is who I trust. And there's an intangible feeling of trust and safety and security and familiarity that we cannot underestimate. And so I want you all, as primary care doctors, as my colleagues in the community, to just remember that. Because quite frankly, we're not going to get to the finish line on the backs of mass vaccination sites. I think the days of mass vaccine sites are numbered. And there is no way that we're going to get ourselves out of this pandemic without your help. And so I really want to implore all of you to consider getting the vaccination directly to your office, working with U of R or regional as appropriate to try to get the vaccine to your office if you can. I know that the systems are experimenting with different ways to either have sort of centralized or rotating vaccine pods. We're still early in that, but I want to do everything we can from the standpoint of the county. If transportation is a concern, please do not let it be a concern. We will find a way to get the vaccine to your door. I know that many of you are concerned about getting a whole tray of Pfizer, knowing that you can't get rid of 1,170 doses right away. Don't worry about that. We will get you what you need, but we want you all to consider giving the vaccine in your offices, because I just don't think that we can rely on everybody to go to a high school or a fire department or a mass vaccine site. So with that, I want to spend 2 seconds talking about how to be a vaccinator. And I'll just say that this is orders of magnitude easier than iStop. Now, I don't know if that's reassuring or scary to you, but this is much easier than iStop. You need to have a way to remember how to get into HCS, the Health Commerce System. As many of you know, that is a password that changes every couple of months. And so I think for many people, trying to remember their password may be the hardest part of the step. But once you're able to log in, you log into the top of the page, and there's a bar there that says My Content. You select all applications, you go to C for COVID, and then you select COVID-19 Vaccine Program Provider Enrollment, and we'll send all this out. We have a FAQ that's pretty easy to follow. And then you follow the steps. Essentially, your medical director or some administrator role in your office needs to fill out the paperwork, and then we'll get it all to you. Excuse me. So Pfizer and Moderna require a freezer or more difficult storage. Johnson & Johnson is much easier. And so I think many of you are going to want to do the Johnson & Johnson. Excuse me. Pfizer will be very appealing to those, excuse me, who want, excuse me.
We can get you a COVID test, doctor.
I tested yesterday, I was negative.
Okay.
I'm gonna give him my bottle of water.
I got it. So many of you will want to do the Pfizer. It's 6 doses per vial. These are all details that we're going to work out with you. And we'll get the vaccine storage FAQs to you all. I think the bottom line here is that we want you all to consider vaccinating in your offices. So with that, I'm going to pause and hand it over to Dr. Clark before I lose my voice. And then we'll go to the breakout rooms.
Okay, thank you so much, Dr. Mendoza. Next slide. So we have 3 questions, and I know you guys are probably pretty efficient. We're doing not too badly on time. But what I'm going to ask you to do is to each group will pick 1 question. So when you go to your breakout room, you'll be assigned a room. So they'll say, you know, Linda going to room 2, for instance. And if you're in room 2, you'll answer question 1. So rooms 1 and 2 will answer question 1. Rooms 3 and 4 will answer questions 2, and rooms 5 and 6 will answer question 3. Okay, so look at your breakout room as you go. So I also have, and Amy, you might need to help me with the link. Let me see if I still have it. There's a link here for a Google form. So when you get into the groups, everybody will have 10 minutes. Thanks, we did it twice. And you'll just need to pick somebody who's going to serve as a scribe. That scribe will click on the link, and it'll be a Google form. And in it, it'll ask, for each question for you to put your notes and then one action item. Okay, so if you have question number 1, which is what tools and staff resources do you need to make it easier to provide education, inform those not yet immunized, blah, blah, blah. You'll fill out, the scribe will take the notes for everybody in your group, but then you'll select one that we're going to talk about. We'll read out after the breakout rooms. So hopefully that's clear. And if you just have lots of time, fill out another question as well if you feel like it. Okay, so we're going to send everybody to a breakout room, and Amy will pop in and see if you have any questions. I'm not going to say I can. I'm not sure how to do that. Okay, here we go. Miss, I didn't have Amy introduce herself at the beginning. Amy, do you want to just let people know who you are? Yeah.
I'm Amy Knopp. I'm a communication specialist with Common Ground Health. Okay, I'm pulling up the form here. So for question 1, the 1-sentence takeaway of what tools and staff resources do you need to make it easier to provide education and inform those not yet immunized about vaccination opportunities. It's low literacy patient education materials that address some of the myths and misinformation about the vaccine and increased use of social media to share that information. Boy, I have great news. We have that developed. So I am happy to connect with anyone who needs that information. We have handouts, we have social media accounts set up, and we are actively developing messaging around the latest information. For example, we have information we shared out around the Johnson & Johnson vaccine around the pause and the restart. And we are working in anticipation of potentially an expansion to 12 to 15-year-olds. We are working on information and social media about that. And you can follow our accounts on Twitter and Facebook as Get the Facts FLX. Okay.
Just by the way, someone texted me that the FDA did approve Pfizer for the emergency use authorization for 12 to 15-year-olds. I think it'll still be a couple more days because the Advisory Committee on Immunization Practices meets on Wednesday, but then I think it'll be good to go.
All right.
And then how do you or could you use your current staff to provide the vaccination? Rotate staff, pay extra funds, ability to vaccinate parents in the pediatric office. Is there a systematic way to approach patients? So ability to vaccinate at the time of education, the opportunity is missed. So if you were able to marry that vaccination education and the vaccination itself, that would be helpful, I'm hearing. So that makes a lot of sense.
I think the other important part there, I don't know if you want us to interrupt
No.
or not, but was, we got to get to a single dose vial or the ability to especially now that we're in the nitty gritty stuff, the ability that when I talk with them actually having to come back for another dose or come back to another opportunity, we're kind of missing out on that. And maybe even the comfort zone that if we have to waste, we have to waste. Better to get some in, getting over that hurdle of no waste policy.
Okay. And then strategies for finding out who in your practice hasn't been vaccinated. So there was a lot of talk about the data and trying to get that information from the electronic medical records. So potentially using NICIS to identify those who aren't vaccinated, and providing practices with data support to utilize the available population health management tools. And I believe there is some resources out there for that as well. So. Nana, did you want to say something?
Can I just ask a question? If we were able to use the Rio to create lists for you, would that be helpful? In other words, like it would probably be a list of your vaccinated patients. So we wouldn't necessarily have your unvaccinated patients, but we might be able to put together your vaccinated patients. Would that be helpful?
Would the Rio be able to send it out almost like a test result?
Like what? I'm sorry.
Like a test result?
Yeah, they, I guess the question is, would you want it as a list or would you want it for each individual patient, like a test result?
I would think with each individual patient, because it could then come into their medical record, right? And that would become but where do they get that from, Nana? I mean, do we feed it out and then it comes to whoever, like if we were doing a community pod, or
So
does it a connection with NICIS and feeds into
Yeah.
your computer?
You know,
You don't want double data either, right?
No, right. The Rio currently gets NICIS data, and they actually combine it with patient data that they have in the Rio. And then that's how we get our data, actually, to be able to track our rates. So they do have it, and they have it from every source in New York State. So the question is, yeah, so would it be best coming to you like a test result on an individual patient?
It would. This is Carolyn Cleary. I'm a pediatrician. Not every pharmacy is inputting into NICIS despite the law. I have seen not every pharmacy or provider inputting, so then the data's not good, because our EMR can pull stuff from NICIS now, although you have to go into an individual patient chart. So I can verify that it's not being done.
It's not perfect, but it's not bad either. It's mostly been Walgreens that's been the problem, and New York State is trying to fix it.
Well, these are great questions, but we want to get to Drs. Connor and
Yes.
Dr. Diego. Dr. Khan Hidalgo. And maybe what we can do, Amy, is summarize those and send them out to the group so that you can make sure you hear what your colleagues said. Sorry about that. You have like 4 minutes. I'm a little behind. So Dr. Connors, Dr. Hidalgo, if you want to talk a little bit about your experiences.
Sure. So I would like to say that, it was instrumental to have the Monroe County Medical Society really help us acquire vaccine, right? That was our first hurdle. And so when we were able to meet with Lucia, as well as Dr. Bennett and Dr. Mendoza, and get some vials to trial homebound patients, that was extremely helpful. So we developed a pilot program through Monroe County Medical Society to be able to, start vaccinating patients in their own home, people that were not going to be able to get to a mass vaccination site. And I think that started or at least paved the way to then see that we could certainly do this kind of vaccination in our office. Dr. Connors and myself, I think the biggest thing I would say is plan your clinic before you even get started. Like, know how you can potentially vaccinate people and know what your maximum number of people that can be waiting in your office safely is, because that's your limited vaccine, right? So in other words, if you have 20 vaccinators, but you can't hold 20 people for, 60 people for 15 minutes, then that's too many vaccinators. And so you really have to have the right number in order to be able to have people waiting at that particular time. And have people, checking people in, having people getting to the vaccinator, having people with them in the back 15 minutes waiting room, and use those 50 minutes to your advantage. One, for patient education, right? So in other words, to teach them why they got the vaccine, why their relative should get the vaccine, and why they should, or their neighbor. And number two, use that 15 minutes. If they didn't fill out the New York State form, have them fill it out. Have a QR code on the wall. They come with their phone, scan the QR code, finish that paperwork. Have your person in the back room help them on a laptop if they don't have a smartphone. Have them register or be safe while they're sitting back there so they participate in that and they just don't walk away without doing that. And then, make sure that any questions or concerns they have, you've answered directly right away. Between Dr. Connors and myself, we've probably vaccinated over 1,000 patients, is my guess, between the two practices. And so it's important to do so. I think just like we've been seeing in the state, we saw a very big slowdown after the first, 800 doses. And, you know, we've actually paused in our office to do exactly that, to figure out who is not vaccinated so we can reallocate another clinic down the road if we have to. The nice piece with the Monroe County Medical Society and Dr. Nana Bennett is that we can get smaller doses now. We can only get 3 vials or 4 vials, or we can get 3 or 4 vials and store them for 30 days and crack the vial when we need to. And I think that's going to be very helpful. Dr. Connors?
I agree. I agree with all of that. I actually, we've had some success vaccinating remote populations. So we did a vaccine rollout to our house call patients. We vaccinated about maybe 50 homeless people. We went to the House of Mercy. And we've actually, a new population that we didn't anticipate has been, when parents have been in here, they've asked if their children or their young adults who actually have roommates that they live with can also be vaccinated. So we've spent a lot of time actually contacting pediatricians and seeing if they wanted their patients vaccinated with us. I don't want to become a hub for vaccinations, but it's been great to vaccinate families, and it's been great to contact pediatricians who have been absolutely lovely at you know, kind of allowing us to vaccinate families to move them forward, or living partners to move them forward, so that we can actually kind of move the community forward as well. So that's been our issue. I agree with Diego. We've had this like a little bit of a pause, but we've then regrouped and kind of started calling again and trying to really figure out how to isolate the population. We're now on this hunt where and we found them, but it's just a lot of education. I can't tell you how important the educational piece is. At a community level, at an individual level, there's people coming in with hearsay every day, and the media is reaching them more than physician offices are reaching them. I have spent so much time, and Diego knows this, trying to get a newscaster to kind of, you know, kind of come and at least document like what's going on at a community level, to show that this is a sort of because campaign, like help us help you. And you know, there's little interest there. There's some, but there's just a little interest. And I'm shocked at that less than 50%. It actually saddens me, because it just seems like we've been trying to educate for so long. Maybe we should have hubs of education instead of hubs of vaccination, so that people can actually get the story straight, because they're clearly, the message about what the vaccine isn't is louder than what the vaccine is.
Thank you so much. I'm so sad that I squished your time. You both are fantastic. And I do need to give a big up to the Medical Society for helping us plan the forum tonight with Lucia. So thank you so much.
Lucia has been amazing. Nana has been amazing. I agree with what Diego said. They have been super great at helping us.
Instrumental.
Absolutely.
And remember, if you give vaccine to people who are not your patients, still put them in your chart. You can inactivate them, and please upload to NICES. That's very important to do. So speaking to what Dr. Cleary was saying, you definitely have to put that into NICES.
Yep.
Great. So, you know, Dr. Bennett, I want to do the Q&A, but I'm thinking maybe you should do the call to action first, and then we can take the Q&A. And, you know, for people who have a little more time to spend with us, we'll do that. Amy, can you put that last slide up for her, please?
Can I show you guys one thing?
Yes, go ahead.
There?
Yeah.
So I'm just going to show you this picture. Okay. Diego's on here. He'll know. But that was our rollout. So we, between his office and our office, we did this on a weekend and have done it on successive weekends and offices. This was like a full spurt, you know, like running out to patients' houses. He was vaccinating, we were vaccinating. It was a very historical time. So I just thought it was really great. Very, very coordination, you know, kind of specific, but supercharged, I think, for our office staff. It was great.
Nana has.
Thank you. All right. I'm going to say just 2 words. No, 3 words. We need you. That's it. And I can't thank Dr. Hidalgo and Dr. Connors for their incredible work that they've been doing. But there are lots of people in our community who have been trying really hard to vaccinate as many people as they can, but it is harder in the office. And we are so impressed by the work you guys have done. And I just want to encourage everyone else to join us, because we're all in this together. If we don't work together, if we don't all participate, we're not going to get everybody vaccinated, and this virus is going to be with us forever. So please help us, help your patients, and let us help you. Let us know whatever we can do to help you to do this. Getting your PIN, getting educational materials, anything we can do to help, we're here to help. Thank you so much for participating tonight.
Thank you. So we're going to stay on for Q&A because we've had a couple questions in the chat box, and want to make sure that if you have some questions that they get answered. So Dr. Bennett and Mendoza, Kathy, if you can hang on for a few minutes, I'd appreciate it. Okay, I think we answered this question already about the pharmacies. I think Dr. Bennett answered that, and that Walgreens having an issue and then the state is working with them. Dr. Beckman has a question. Does having people getting vaccinated in the office increase other patients' interest in seeking vaccination? I'm thinking this is for Drs. Connors and Hilda.
That is absolutely true, right? So you bring one family member in and you'll have pretty much all family members. Every once in a while, you'll have that one outlier that needs, the extra 5 or 10 minutes to explain to them why science works. But other than that, I think it's very, very important.
Well, Dr. Connors, did you have anything to add to
no,
that?
I totally agree. I've had highly educated people talking about 5G connections and a lot of sort of extraneous things that they read, and actually physicians who are pushing a lot of this information in the community and on air. And it has taken probably 20 minutes. Robin Upham kind of talked about this too, 20 to 30 minutes in the office to encourage them to listen to their physician rather than one online. And it has made a difference. Within like 2 to 3 weeks, they came back with their vaccine card if they didn't know that we were, if they couldn't coordinate with what we were doing. And they were very excited about telling us why they had changed their mind. So it absolutely makes a difference, but it's been super great to vaccinate apartments full of people that live together, that want to do, that are conscientious for their parents, that want to do the right thing for people who have been sick, who have respect for people who have died of COVID. That has just been one of the most rewarding experiences.
Thank you. So I'm going to throw this out to the 3 doctors who've been talking about vaccinating their office. So Hidalgo, Connors, and Mendoza, can you finish the statement regarding giving the vaccine in the office? I wish, fill that blank in.
We could have started back in February.
Good. Dr. Connors?
Oh, I wish I had more staff now. We're an underserviced population. It is very tedious on staff, I have to say. But no, I have to say, Diego, that was perfect. We're behind, and I feel it, and I'm sad, but I think we need to push. It's got to get creative, and we've got to reach a variety of people in a variety of different ways. We've got to cultivate the culture. I
guess I would say something else someone brought up. I wish there were smaller, less doses per vial or single dose syringes would be a lot more helpful.
Agreed.
So just a quick comment on that. New York State has put out guidance for single dose syringe, pulling up the syringes and transporting them. So that is not impossible.
Correct. Right.
Something that you could discuss with the health department, certainly.
I was thinking more that you have them ready rather than the 6 hours, right? So if you have a single dose vial, like someone brought up before, you actually can hold on that vial, crack one vial and be done, right? So that you don't have to find 10 people or 5 people, right?
Right.
And if you had smaller allotment, you could certainly get through it in a given day and not waste. Because at the end of the day, I still don't want to waste, right? I mean, there's a need in our whole world, right? And we should be patient-centric, right? We shouldn't be, vaccine-centric or anything like that. And we have to drive by what we have and help everyone.
Okay, I think Dr. Beckman had another comment. I encourage everyone to talk with their patients, either using robocall, sending out a letter to unvaccinated patients, or developing a strategy to have staff recommend vaccine at each visit if not already vaccinated. Those are all good. Did that come up in anybody's discussion groups?
Actually, we're just starting that right now at our FQHCs. Is everybody that walks through the door, whether it's with finance, the patient navigators, you know, the dental side of the house, behavioral health, everybody's going to ask the question in May, have you had your vaccine? And how can I help you get it? And we posted posters on every single door, including the bathrooms, because as you know, that's where the best information gets displayed, is in the bathroom. So, but again, it's how can I help you get scheduled for it? Not, are you interested? It's how can I get you one?
Excellent.
And just to comment on that, also in previous work that Peter Szilagyi did with kids and I did with adults, having the staff engaged is really important.
Absolutely.
Has anybody gone into the schools?
Yeah.
Mhm.
Yeah, the Monroe County Department of Public Health, I don't know if they're still on, but
I think
they're
Dr.
doing,
Mendoza had to leave. Kathy, do you have any?
yeah.
Yes, we're working with Dr. Wilson with the school-based clinics, and 2 of them have pins. I'll be meeting with them tomorrow to train. We're also doing a number of clinics in the high schools. So I don't even think I can name them all, about probably 13 or 14 clinics that are set up in the school settings for just sort of 1-time or 2-time pods for Pfizer. And that started last week and will continue probably through mid-June.
Let me just put a plug into utilizing some of the pediatric experience with vaccine hesitancy. Pediatricians have been dealing with that issue for quite a while, probably more so than many adult physicians or providers. There's a pretty well-established literature on how to approach it. You don't have to be an expert, but a couple simple ways to state things can work much better than other ways that physicians commonly frame things. So I think as you move forward, capitalizing on what people have already learned from other vaccines about how to message, like the expectation is, we're going to vaccinate you for COVID-19 today, rather than asking an engaging question like, what do you think about COVID-19 vaccine? You know, we dig ourselves a lot of holes sometimes in practice without intending to. And so people have commented on this throughout this wonderful forum. You practice and you learn the simple phrases that work, that get the job done and don't slow you down more than you have to be slowed down. I think this group could really facilitate the process of sharing those simple messages. You don't necessarily have to teach all physicians everything there is to know about motivational interviewing, but if you can teach them a few little phrases, we used to, in teaching, call it arrows in the quiver, things you can roll out and use on occasion because you know the patient, you know what tends to motivate them, and maybe you know how to say it and maybe you don't, but simple little messages can be very helpful.
Dr. Murray, did you want to comment on what you wrote in the chat?
Just to echo what Dr. Chamberlain just said, I think that, you know, the anti-vaccine rhetoric, especially now that the kids that are getting vaccinated or have the opportunity to be vaccinated, is really ramping up. The rumor mill is huge, but again, there's just so much, and I've seen lots and lots and lots of chatter about people trying to start something with Webster contracting with acute care kids and other schools teaming up with groups to get vaccines in the school. So I think just, we know we're going to do it right and do it ethically and do it appropriately, but maybe kind of heavy handing the messaging of course parents have to consent, of all of those types of things might be helpful.
That's a good point. Thank you. Okay, I don't see any other questions in the chat. Does anybody else have any other questions before we jump off? I appreciate your sticking around with us a little bit longer. But thanks again to
the last thing I would say is just remember that, you know, to get your COVID PIN number is a little more complicated, and you definitely have to go through HCS for that, and you may need help. Reach out to people who've done it. And so feel free to ask questions and go any stage that you have a problem, reach out to, I'm sure, Dr. Connors, myself, Dr. Bennett, happy to help in these situations, right? Lucia. So reach out. If you find something where you're stopping, just ask us.
Thank you.
And Kathy has been walking a lot of people through that process, right?
Yeah, absolutely.
Yeah, the form is so many more pages longer than it needs to be for primary care. It's ridiculous. So it's okay to leave it 3/4 blank and they still give you a COVID pin.
Mhm.
Thank
We'd be happy to provide people with information that our patients have found helpful about educating, so they don't have to reinvent the wheel either. That's also something that we'd be willing to do.
Yeah, and please
Do
go to the
put your
website.
contact
There's
information in the chat, Dr. Connors and Dr. Hidalgo.
Yes.
Thank you.
And I'd just like to take a moment here this is Lucia from the Medical Society. Just a huge, huge shout out to Dr. Hidalgo and Dr. Connors. Having you present tonight and really participate in this and sharing your testimony on the challenges, but the successes of going through this process to vaccinate your patients and beyond is absolutely incredible. And so I can tell you that getting some text messages from folks who are telling me, thank God that they were on. Your testimony is incredible and it's just so helpful. I also really have to give a huge shout out to Kathy Hiltunen in the county, who has just been amazing, as well as Nana and her team. And of course, Dr. Clark. Honestly, everyone here is working together collaboratively. The level of leadership in just overcoming the challenges and coming together to supply the resources and the tools has been phenomenal, and it really is quite impressive. So I just want to give a huge thank you to all of you. That was a kiss, by the way. Mwah. So thank you all very much.
Thank you so much, everybody. We're going to say goodnight. Appreciate all of our colleagues, as Dr. Lucia. As Lucia said, thank you so much for coming out, and have a good evening.
Don't procrastinate. Vaccinate.
Thank you all so much.
Bye-bye.